Hi, everybody. My name is Mike Posado, and I am a veterinarian here at Mississippi State University. I'm originally from Ohio. I grew up on the coast of Lake Erie in Vermilion, Ohio. I went to college in Ohio at the University of Findlay, and then came down here to veterinary school in 2011. Graduated from Mississippi State University in 2015. From there, I ended up going up to the University of Pennsylvania, doing an internship and residency, and I stuck around for 2 more years after that, so I was there for 5 years. I'm board certified with the American Board of Veterinary Practitioners in food animal practice, and I am a food animal veterinarian here at Mississippi State University. I work in the food animal medicine and surgery side of things, and I do ambulatory work as well, which is what we're doing today. A food animal veterinarian is a veterinarian who works with cattle, sheep, goats, pigs, even poultry and aquaculture. For me, my specialty is in food animal ruminants, so cattle, beef and dairy, sheep, goats, and I also have some work with swine. I do a little bit of camelid work, which is not a food animal. That's more of a fiber animal, which is another working type animal, but not technically a food animal. So today we're processing cattle for a large operation. We have about 450 cattle to go through today. So we're working with mostly Santa Gertrudis, which is a beef breed, as well as Red Angus, and then the cross between those, which is called an American Red. So we are vaccinating, deworming, preg checking, and then we're also collecting some samples from some of the babies for disease screening and monitoring. So we're checking the babies for mainly one disease. It's called bovine viral diarrhea virus, and it is a virus that causes essentially pregnancy loss and issues with the moms, but also causes the babies to be very, very sick and immunosuppressed. So there's no cure for it, so we have to monitor for babies that are affected in utero and are born persistently infected and carrying the virus. And we're taking a sample from the ear, an ear notch, to look for viral particles within the ear there.
Cow calf is more or less you have the mom who has the calf, and you can sell them to sale barns or stocker operations, but you're the front man. You have the mom and you raise up the calves until weaning age, and that's usually when you sell them.
Today we are vaccinating against some respiratory diseases as well as clostridial diseases. And so clostridial diseases are a big concern because liver flukes are pretty common in the area since it's so wet. And there's a couple Clostridium that can affect cows with liver flukes, Clostridium novii and Clostridium hemolytica. The way that we vaccinate cows is we vaccinate them based on pregnancy cycles. And so we will vaccinate pre-pregnancy, and we'll also vaccinate before they calve to give some antibodies that they'll get with their colostrum, so the calves are covered as well. And then we also do those pre-breeding vaccinations to help just keep the cows healthy from different diseases. This is a vaccine gun that we use for cattle. We get to set how many mils that we put in there, so every vaccine, a dose may be different between 1 to 5 mils. And you just squeeze it, and it gives it the amount that you need.
Basically, worms, depending on where they are, can damage internal organs, cause things like anemia, which is blood loss in cattle, or they could just make them be poor, which when I'm saying that means that they don't gain weight as well, they don't keep weight on as well, and that they're kind of runty. And sometimes an easy way you can tell that is if they have big bushy hair and they're not slicked off like some of the other calves. That's a simple indicator of like they may have some worms.
So right now I'm using albendazole, which is a dewormer, and we're just deworming for intestinal parasites, which is just a routine thing you do with cows.
So this calf was brought to MSU-CVM because he has diarrhea and is acidotic. Also, he has castration complications and is dehydrated due to the loss of fluids and electrolytes from having diarrhea. Right now, the veterinarian and students are working to fix the acidosis and get diarrhea under control, so they can surgically fix the castration failure. He was castrated using a small rubber band, which is the lastrator method, and due to the band not being tight, it popped off. So now the calf has ischemic necrosis, which basically means that the skin and even some of the underlying structures may have died and started to fall off. But because that band wasn't tight enough or on the calf for a long enough time, there's still some live tissue that needs to be removed. Here they are taking an ear knot sample from the calf to test for bovine viral diarrhea virus, which is a virus that can infect the calves when they are in utero and possibly create a persistently infected calf. These calves are born with the virus and shed the virus to other animals. It's important to diagnose and remove these calves, and if this calf was positive, it would not help him to perform any treatments due to the untreatable fatal nature of the virus. Our next two patients are two cows with two different problems. Here you will see a veterinarian and veterinary student tie the cow's halter to a board. They are doing this to stabilize the head while the cow is being turned by the chute. The chute in this video is commonly used to work on cows' feet, whether that be a hoof trimming or resolving an issue. First, they are spraying off the feet with a hose to clean any excess manure or debris. In this case, for the first cow, they found a subsolar abscess on the right hind lateral claw. They trimmed the feet using grinding tools, hoof nippers, and hoof knives. Once finding an area of concern, they used the hoof knife to clean it out and remove any dead tissue. A block was then applied to the medial claw in order to take off the pressure on the lateral claw. This is so the animal doesn't have to bear as much weight on the lateral claw. The block is glued on with an epoxy that sets very quickly, so speed is important here. Abscesses are mostly caused by injury to the sole, like stepping on a rock, dried mud, foreign body entry into the sole, like from a nail, and they do open it up and allow it to drain. Now, the second cow possibly had some barbed wire wrapped around the foot, and this video shows them cleaning out an area near the heel that was affected. Everything is almost healed at this point. Then they are going to do some routine trimming of her feet as well. You can also see the healing area under the dew claws where the wire was also wrapped.